Well, good morning, everyone. Hope you're having a great start to your day, and we're happy to have you come on with us. And we'll say hello to, as usual, a few friends here that join us live. We sure love saying hello. And Brahim, guess what? You're number one on the hit parade today. Michael from Norland, number two. Andrea, Niagara Falls. Good morning to you guys as you get your notifications. Fran from Orangeville. Sandy from Fergus Falls, Minnesota. And Nativity, good morning. And Brahim is saying happy 4th, on the 5th. Janice, good morning. Nellie, how are you? Judy from Manitoba. And Gloria from New York. How are you? Kevin, there he is from Oshawa. Good morning. Rosa Modial, how are you? Nick from our staff. And Jude from Troy, New York. Yalam, bonjour. And Sandy from Chilliwack, British Columbia. Kathy, good morning to you. Georgie from Halifax, Nova Scotia. Marvel, Ottawa. And Judy, New Brunswick. Rose, how are you from Peterborough? And Brahim is saying hi to Kevin, Maryland, Kelowna, and Karen, Peterborough. And Vince, how are you today? Happy Friday to you. Rosalinda saying hello, hello, hello. And Catherine, Newfoundland. Sandra, Espanola, Jeanette, good morning. 101 in Portland today, Oregon. Wow, Dave. Carol, Mount Pearl, Newfoundland. And I'm going to say that was Milika. Chantal, Ottawa, how are you? Fran, Tilsonburg. Jan from Flin Flon, Manitoba. Donna, how are you from Park Hill? Liette, John, Elgin, Illinois. And Francis from Vaughan, good morning. How are you? Donna from Bell Valley. Paul from Edmonton. Good morning to you. Gary from Muskoka. Lori from Alberta. Louise. Okay, a couple of more and let's get going. Adeline. How are you? Deb from Timmins. Sharon. Albaline, Kansas. Thea. And Beverly from New Brunswick. Doc McEwen, how are you? Doc, good to hear from you. Bonnie, Little Britain. Sue, how are you? And another Donna. Hi, Donna. Madeleine, how are you from Kippawa, Quebec? Helga from Scarborough. Wanda, good morning to you. And Jeanette from our staff is on with us today. Okay, let's get to some questions here. Beverly, what is pulsatile tinnitus? Well, it ain't any fun. That's what it is. Pulsatile, big word. You actually hear that pulsating sound in your ears. And on top of that, you've got a ringing tinnitus, no fun under the sun. Now, a couple of things I want you to keep in mind when I talk about this, Beverly, is a couple of things I want you to check for, okay? Number one, make sure you're not low in iron, because that sometimes happens. Your iron, you got a slight iron anemia. I've seen that before, and you get that pulsating tinnitus. Okay, not always the case, but it can be. Another factor could be insulin resistance. You can get insulin resistance from your nose to your toes. And the other day I was bringing to you insulin resistance at the joint level. Your joints literally can lose their sensitivity to insulin. Big thing. And Your skin can. Every organ in your body can. And another area is in the area of your ears, tinnitus. So be careful, look for that. You might want to do the reset. In practice, I used to look at deficiencies, sometimes, not always, but sometimes, more often than not, low vitamin D levels, low B12 levels. Look for that. Low magnesium levels. Okay? So those are all things, Beverly, you can look for. Judy. And when coffee beans go through the process from dark, medium, light roast, does it lose its nutrients? Not really. It depends what kind of process they're using. But at the end of the day, no. That's, they've said, anything that I've read about coffee, and I've read everything. The dark roast probably has slightly more antioxidant value in that, but it's very slight. All coffee is good. Okay? Nothing negative about coffee. Nothing. Okay? So I haven't seen anything that would tell me, Judy, when you're getting a light roast or whatever that is deficient in all those 1,000 phytonutrients that you get in coffee. Take the gift and enjoy. One thing about coffee, a lot of it is taste, right? I mean, you just like, I'm a dark roast guy. I like dark roast more for me, okay? And, they're all good. That's what I want to tell you. They're all good. Okay, now, Jennifer, how many micrograms of vitamin K2 should we be getting per 1,000 IUs of vitamin D? About 10 micrograms for every 1,000. You could go higher than that. There's no real... We put, I believe it's 10 micrograms in our vitamin D. That's what makes it so... I don't... Look, if you're getting the sun, best way to get vitamin D. Okay? Best way to get vitamin D. When you're supplementing, make sure you're getting your vitamin D in a supplement with vitamin K2. And the reason for that is because as you're making, your body is, you take a supplement and your calcium levels are naturally going to go up. Vitamin K2, what it does, and we talked about this the other day, it's got two factors in it. One is the broom, where it actually sweeps. It sweeps the calcium out of your blood vessels, out of your soft tissue. It's got a sweeper in there. And the other one here, let me just get you, I'm having a senior moment, so I don't mind telling you. We did a podcast the other day on, and I entitled it, "Where Has All the Calcium Gone?" Okay? Because I was talking about the connection between osteoporosis, a lack of calcium, and atherosclerosis, too much calcium in the wrong place. So where has all the calcium gone? It's gone out of bones into the bloodstream, into blood vessels. They always want to blame cholesterol for what calcium is doing in blood vessels. Atherosclerosis is not cholesterol. Yes, it's there. It's there to help heal the calcium, the calcium damage. You get calcified. That's what atherosclerosis means. It means calcified blood vessels. So where has all the calcium gone? From bones. 1 out of 5 women have osteoporosis. It's come out of bones into the bloodstream. Now, vitamin K2 is an essential vitamin. It never gets the recognition it needs. I love vitamin K2. I've been talking to you about it for eons of years, the importance of vitamin K2. Now, what did I say the other day about vitamin K2? I want you to eat it. Eat it. Why? Because in nature, vitamin K2 is found in the animal kingdom. Unless you're living in Japan, where they take natto and they eat it. Okay? Yuck. But vitamin K2 is found in the animal kingdom. So when you eat a piece of cheese, you get vitamin K2 with calcium. Do you think God didn't know what to give us to get our vitamin K2 and to take calcium and put it into our bones and teeth where it belongs? Not in the bloodstream. So when you eat a piece of cheese, when you eat butter, the highest source of vitamin K2, by the way, is found in cheese curds. So cheese, butter. When the cow eats grass, okay? When the cow eats grass, it eats grass to get vitamin K2 into dairy, into meat. Okay? So, when you eat eggs, meat, and cheese, you got vitamin K2 and calcium together. That's the way it should be. When you're in the plant kingdom, okay, you're eating a salad. You get vitamin K1 and calcium. Is that good? Not necessarily. Because vitamin K1, look, it's a vitamin. It's all right. It's good for you. It helps with clotting. The problem with is when you're eating calcium without vitamin K2, calcium will not get to the intended destination. It will stay in your bloodstream. It will stay in your soft tissue. It's not meant for that. So when you're taking a vitamin D supplement, this is why we recommend you take vitamin K2 with it. And that's why we put it together in a supplement. Got the memo? Yeah. Eat your vitamin K2. Eat it. Eat it. Eggs, meat, and cheese. That's where you get vitamin K2. It's one of the reasons another reason for the reset. Okay? People always thought I was mad. Crazy. Okay, with the reset. I mean, you wouldn't believe the pushback I used to get. I still get it a little bit, but not as much as I used to. But I used to get so much pushback. It's acidic. Imagine, how are you going to live for 30 days on eggs, meat, and cheese? I mean, come on, doc, are you crazy? No, I'm not crazy. Well, maybe a little bit crazy. But I was right. I was right. And the more they study vitamin K2, the more they realize how important that vitamin is. Because where has all the calcium gone? To the wrong place. That's where calcium has gone. It's in the wrong place. We have atherosclerosis starting in young people, for heaven's sakes. Okay. Thanks for the question, Jennifer. Flo is asking about bitter melon to lower blood sugar. Yeah, I had patients who use bitter lemon. I got no problem with that. I think it has, look, sometimes these, you would take bitter melon as, mostly as a supplement because you can get it in supplement form. It was not my favorite in terms of lowering blood sugar. I like it in a combination with other things, okay? Because I was big on cinnamon, alpha lipoic acid, okay? And bitter lemon, yeah, I got no problem with it. Not just so much on its own. And because on its own, I felt after a period of time, it wasn't as effective, okay? But I like it. I got no problem with it. Okay. Brenda. Another one on vertigo. Okay. I deal with vertigo. I watched a YouTube from a doctor that says many times you get vertigo because you need more vitamin D. You see? I don't disagree with that. Okay. A lot of times you get vertigo. Sometimes vertigo, by the way, is virus in the inner ear. Vitamin D, I agree, is excellent. And Brenda's asking, he says to take all at once 50,000 IUs of vitamin D with K2 once a week. Is it safe to do the 50,000 units? Well, look, yes, a week. I just got to tell you about people that have done research, okay, on this. And even my own personal experience. Vitamin D, okay, in high doses. Now, don't just do it on your own. But I like vitamin D in high doses. I called it the hammer. Okay? The first sign of a cold or a bad flu or whatever, vitamin D hammer was between 20 and 50,000 IUs of vitamin D for 3 days. Once a week. Yeah, I got no problem with that. I got no problem with that. I mean, therapeutically, vitamin D is fantastic, guys. It really is fantastic. And you know what? They sort of lasso me as to what I can say. Okay? Because there's a war on vitamin D. And so I'm just telling you, Brenda, the safety of vitamin D is incredible. I pontificate about that all the time because they got you so scared of vitamin D, it's incredible. And yet, therapeutically, it is so good for you. Viruses, infections of any kind, your vitamin D, you're a human solar panel. So, I often saw it with tinnitus, like I mentioned earlier, Brenda, that they were low in vitamin D. Okay, thanks, Brenda, for the question. Shelley, is it true you cannot be in ketosis for surgery? Well, I'm only... Shelley, the only thing I'm going to tell you is I don't know where you read that or heard it, but I think, and again, I don't know where you'd have to give me more information. But here's what I got to tell you, okay? usually when I hear a question like that, it's because the people who were talking about ketosis were confusing ketoacidosis and ketosis. Okay? They're two different things. Ketosis, if you're not having any carbs, you're not burning carbohydrates, you're burning fat. That's ketosis. Is there anything wrong with that? Nope. I would think you'd even do better in surgery if you were in a ketotic state. Now, ketoacidosis, now that's a different puppy altogether. That's when your body cannot control, usually, blood sugar. And diabetics get it, especially type 1 diabetics. They can go into ketoacidosis, and boy, that can kill you. That's a different puppy altogether. And so I can't think of one reason, Shelley, why you couldn't go into ketosis and go to surgery. As a matter of fact, I think you would do better. Now, again, was the thing you were reading or the thing you heard, were they talking about ketoacidosis? Or you don't want to be going into, you don't want ketoacidosis. But ketoacidosis, you're dying unless you fix it. So I can't think of a reason why you couldn't be into ketosis. Okay, Shelley, thanks for the question. And Sherry, is this another Sherry? Hold on. Okay, Sherry. Okay, no, the other one was Shelley, so it wasn't Sherry. This is Sherry. I had blood work done. The flow of blood was slow. I drank 64 ounces a day of water, good girl, and drank 16 ounces glass before the blood was taken. This is the first time it has happened. Now, Sherry, look, I just want to make sure I'm understanding what you're asking me here, okay? There's two things. One, when they obviously were drawing blood. Is that when your blood was slow? They were taking vials of blood to do blood tests. Or, and this is important for me, Sherry, it's important I understand this. Was it after, when you got your results of your blood testing, did they tell you that your clotting factors were high? I need to know that. Okay? I'm assuming from your question that when they were drawing your blood, you've never seen this before, they had trouble getting your blood out to give them enough vials. And that can often happen with dehydration. Is that what you're asking me? Or, and the reason I'm confused, because at the end you say this, okay? This happened for the first time, and then you said, I am supposed to take aspirin, but hesitate to do so. Now, did they tell you that because of your blood test? Or did they tell you that because of how slow your blood was when it came out? I need to know that. Okay? I need to know that. Because, and guys, it's not even me. It's not me. I did this years ago. I did a video that got almost 2 million downloads on an FDA announcement on aspirin. Okay? It got over 2 million views. And it was this, okay? It was in my radio show days. I did a video on what the FDA was saying about aspirin. Don't take it. Don't take it daily. The risks of taking aspirin daily, according to the FDA, the risk of taking aspirin daily far outweighed, according to the FDA, the benefits of taking aspirin. What does aspirin do? It thins your blood. What are the side effects of aspirin? Common. Bleeding internally. You wouldn't even know it. Can be very dangerous, even lethal. It could create an ulcer. And you wouldn't even know it. A bleeding ulcer. Now, again, I'm telling you what the FDA said. Now, aspirin was always touted as a miracle drug. Miracle drug. And if you're having a heart attack, if you can swallow a bottle of aspirin, it wouldn't be a bad idea. But again, coming from the FDA, they said, nah, don't take aspirin every day. So, Sherry, back to your question. Okay? You said I am supposed to take aspirin, but hesitate to do so. So what I'm asking you to do, Sherry, give me more information so I can answer your question properly. You need to send the email with more detail of the questions I just asked you to information or info@martinclinic.com. Okay, send it to info@martinclinic.com. Give me the information. I'll give you a better answer. Because right now I'm a little confused. I'm not sure. Was it during them taking your vials of blood? And maybe, I don't know, the nurse or whatever said you should be on aspirin. Okay? Or was it after you got your blood results and they said your blood was as thick as molasses and it was clotting way too fast? I need to know that in order to give you a right answer, Jerry. Thank you for the questions. Marilyn, my TSH, okay, thyroid stimulating hormone, thyroglobin antibodies, yep, okay, and peroxidase are high. And Marilyn says, I take thyroid support. Any suggestions? Well, Marilyn, again, I'm going to go back a little bit and ask you more questions, okay? So again, info@Martin Clinic, send me more information. I'll give you a better answer. Because if your TSH is high and your antibodies are high, okay? Your thyroid antibodies are high and your peroxidase are high. Usually, that tells me you have an autoimmune disorder, okay? Either Hashimoto's thyroiditis or Graves. But I need more information, Marilyn, because you didn't give me any symptoms. And I hesitate to talk about the thyroid without having symptoms. At the Martin Clinic, when I was in practice, you didn't get to see me unless you filled out an extensive questionnaire. You were told to come to my office before an appointment. You needed a half an hour to be there to answer every question I had. And I broke it down. I don't have it in front of me, but I know I have a copy somewhere. I'll actually show it to you or show my audience. I had it broken down. cortisol questions, insulin questions, thyroid questions, and some of them, of course, overlapped. I asked the same question, but I had them in categories. Okay? Estrogen questions, testosterone questions. Guys, remember, I was in practice for almost 50 years. What I learned was ask questions. My dad taught me that. Ask questions. Your patient has inside information. You need to get questions answered. Because especially with the thyroid, numbers, look, just because I've had a lot of experience, and I wrote about this in my book, Sun, Steak, and Steel, the tests that you need to get done, one of them was TSH. And almost invariably, not every time, but almost every time, when your TSH wasn't at a certain level, I knew that your thyroid was sluggish. But I never, ever, ever made a diagnosis of thyroid without a questionnaire being answered. And so, Marilyn, that's important to me because you're saying you're on the thyroid support. Okay. Wonderful. And folks, I'm just going to tell you, I'm going to toot my horn. You find me a thyroid product as good as mine and good as ours at Martin Clinic, good for you. But good luck trying to find it. I dealt with thyroid for years and years and years and years. And remember, thyroid never, ever acts independently. And there's no use just trying to aim at the thyroid with a thyroid supplement, okay? Like iodine, for example. Okay, people, do you like iodine, Dr. Martin? Yeah, I do. On its own? No, I don't. Because one thing I know, iodine doesn't work properly without selenium. Where do you get selenium in food, by the way, guys? In the animal kingdom. It's not found in the plant kingdom. Selenium is not found in the plant kingdom. And I used to tell my dear vegetarian and vegan friends, you're messing with your thyroid. What? You're messing with your thyroid. Because your thyroid needs selenium. And you're not eating any selenium. You're messing with your thyroid. I used to tell them that. Okay? So, Marilyn, back to your question. Give me your symptoms. Because numbers, I'm interested. I never tell people that I don't like labs. I like labs. But I'm not hijacked by the labs. Medicine today, unfortunately, and they're so specialized. You get an endocrinologist. They're so specialized that they rely on numbers rather than your symptoms. You need to marry your symptoms. Like, I'm losing my hair, doc. I would just, here, let me give you, I made a list the other day because I used to ask these questions in my office. Under thyroid, how's your hair? Thinning? How's your nails? Brittle? How's your skin? Dry? How's your eyebrows? Thinning? Okay. How's your energy? Lethargic? Okay. How is your weight? Gaining weight without changing your diet? Could be weight loss too, without any changes. That could be your thyroid. Could be hypo or hyper. Most of the time I saw hypo. But I would ask these questions. Depression, thyroid. Constipation, thyroid. I would ask those questions, you see. And so when a patient finally got to see me, I would look over the questionnaire before I would go into the office and see that patient. Before I went into that examining room, I had their questionnaire and I had this stuff flagged. Okay. They got all the symptoms of thyroid, sluggish thyroid. Now, I would do my independent testing, and oftentimes we had all the lab testing done, even before I saw that patient. And I used to look at that patient holistically. Liette is saying, I miss those visits. Yeah, a lot of people. I'm trying to think of how many of tens of thousands of patients I saw over the years. Tens of thousands of patients. And how many patient visits? Over 100,000, I think. Calculating them. It's a long time in practice, okay? But guys, I was a big guy. I loved getting your blood work. I really, really did. But boy, oh boy, oh boy. I wanted to read the answers to those questions because your symptoms are important. Why do you think millions of people, even today, they fall through the cracks? They're not well. They're exhausted. They don't feel good. And they're not getting any answers because doctors, God love them, were hijacked by the pharmaceutical industry and they were hijacked by the labs. The labs meant everything. And the thyroid, I'm sorry, if you're just relying on labs, you're going to miss out on most people. You're just going to miss out because the ranges, even just for TSH, are from here to eternity. And what's normal can often be so misleading. Anyway. Okay, guys, I think I got to all the questions. That means Monday will not be question and answer Monday. I think I got to them. Okay, you guys are wonderful. Thanks for sending in those questions. And if there was any I missed, you let me know. You let me know. Okay. We love you guys sincerely and dearly. We'll talk to you soon.